You guys saw over on Dana's channel yesterday how we are getting rid of a lot of the kids' toys because we have clutter all over the house. And when they have these toys that have like lots of little pieces and like little blocks or little animals or little people or little anything, and they just get spread all over the house. That is a lot of junk to clean up. So tonight we are going to box up a lot of these toys and get rid of them. Well, not get rid of them, we're probably just going to save them. And then once in a while, we'll go back and replace some of their other toys that they're kind of done. We're just going to leave a couple of them out for them, but most of them we're going to put away. And then maybe every couple weeks or months, we'll just replace a couple of the toys they have out with a couple of other toys that we're going to pack away and put away. But while we are cleaning up, Dana has been working pretty hard on getting us set up with health insurance because I am self-employed. You know, I do YouTube stuff full-time. Which I love, and I wouldn't trade it for anything except for the health insurance nightmares that come with all the new ObamaCare stuff. This isn't necessarily meant to be like a political rant or anything like that. It's just sharing our experience of what it's felt like so far with all the changes.
I actually kind of made a database, so I'm telling more truthful information about this than just like my emotional opinion on it.
You got it all recorded, all the data written down?
Yeah, so I went through all my phone records of all the phone calls that I did over the last 2 weeks, and added up the minutes of how many minutes I spoke to who or what or was on hold for so many minutes, and then wrote little notes next to them. So this is what I'm going to be going off of as I talk. This whole thing started, we are on Cobra with Tim's old job, and because he's not working for them anymore, we figured, you know what, let's go ahead and just get on our own personal plan. That way we can just not have to, I don't know, it's just easier to get on your own personal plan.
Well, we don't have a choice because I can't stay on Cobra forever.
True. It'll be running out this year. So, used to, I could just call Blue Cross and I would have like a 5-minute phone call and say, hey, we want to be on this plan. And they'd be like, okay, you are. And that's it. But this time it took, I don't even have that one on here. It took quite a while. I think like an hour to go through the whole entire government form that they had to fill out for us in order to get insurance. Anthem, our Blue Cross Blue Shield company. And then through the whole thing, it showed that we should have gotten almost a $400 subsidy to help pay for our individual plan. So, but then when it went to submit it, it didn't give us a subsidy. And he was like, well, that's strange. I can't do anything about that, but here's a phone number that you can call and ask them why.
What we're paying for right now, actually, to get the exact same plan, was another extra $400 to get the exact same thing that we currently have. And have pretty the same, almost the same plan that we've always kind of had for years and years and years. It's always cost us around $750 a month, but for the exact same thing, it jumped up to $1,000 something a month.
So only $300 more.
Yeah, so we're what happened? That's a big jump for us to keep the same plan, you know. So that's why we wanted the subsidies, so we could just kind of stay where we were at.
It would have been a lot nicer for our budget, and yeah. So I called our State Connect and was on the phone on hold for 2 hours, and not joking, on hold for 2 hours before I even got to talk to somebody and talk to that person. And they were like, well, hang on, let me transfer you to the people that you need to talk to. And I said, wait, do you have a direct number that I can have in case I get disconnected? And they said, nope, that department does not have a direct number. Really? So they transfer me. I'm on there for 9 more minutes. I get a hold of somebody else and they're like, how can I help you? And then the next thing I hear is, this call was not transferred correctly. Goodbye. Hung up. After 150 minutes on the phone, I get hung up on. I was livid. My very first experience working with this government health garbage. Not a good start at all. And in between all of this, I was also online chatting with a guy.
On the government website?
Right, on the government website, trying to speed stuff up. And when I finally got through to him, I think it was on hold for maybe 45 5 minutes in my wait list of like however
chat.
many people, to be able to chat with somebody. And then he couldn't do anything. He couldn't give me advice because it was just online, and so you can't do anything personal except for he could have maybe like told me another phone number, which I already called to call again. But his piece of advice was, well, I'm sorry, I can't do anything. Try calling back again at 8 a.m. tomorrow. So I came downstairs and just cried to Tim. So then the next day, 8 a.m., I call and get a hold of somebody immediately, and they said, please call back later because we are updating our systems. So I called back in half an hour, thankfully got through to somebody. Well, no, I was able to at least hold for an hour at that point, and got through to somebody, and they said, yep, you don't qualify for a subsidy, but didn't have a reason as to why or anything. So I got transferred through to the people that actually like make the decisions on the subsidy, and she said, I'm gonna fax your information through. There was like something wrong on your application, so we'll try to fix this and I'll get back to you by the end of this week. So the next day though, after the lady said like, don't do anything, you're fine until the end of the week, like I'll get back to you, I got a text message and an email saying that I had like an urgent message that I needed to go and check online and get an answer in a timely manner about our application. So I was like, okay, I need to get to this. I need to do this. I was at the Y working out when I got these messages, and so I was like, I'm gonna be on hold for quite a while. My class is only like, I was in an aerobics class calling because I knew I was probably gonna be on hold for quite a while, and I figured I'm just gonna work out and do my squats and do my kettlebells like while I'm on hold, and like just do one hand and then switch into the
So you got like your hands free set or your headphones or something.
I needed something. During class, it kept on giving me the message saying, if you would like, you can leave a callback number, press 1. So every single time the stinking message came up, I was pressing 1 like crazy, trying to get through. It never worked. Like, you could not leave a callback number, even though it was saying you could. The system was broken. So I never got through to anybody. That was over an hour of trying to get through to somebody, and it just didn't happen. So then I got online and was chatting with somebody again, and they're not help at all online. Because then that person said, because I've gone through an agent through Anthem, and I didn't just sign up on my own by myself online, that person, the online help dude, said that I should go and I should start a new application online, and after I put in enough information, then my two things will link. That did not happen. So then I had to get on the phone and try to call and get a hold of somebody. And when I did get a hold of somebody, they said, no, it's not going to link. You shouldn't have done an application online. Just leave it alone. It'll disappear in 60 days. I was like, all this work today for nothing. And that person was actually able to like read to me just saying that like my application was open or something, and it was just a message that I didn't need. Fast forward to Tuesday this week, I get through to somebody after I was on the phone. This says I was on the phone for 200 minutes for this phone call to get this answer. 200 minutes later, I get the answer of all of a sudden our kids are like approved for Medicaid. And I was like, well, that's weird. Like, I talked to a lady and she was like, hold on 1 second, let me do something. And like random, the kids are approved for Medicaid after I already had like an official letter saying that everybody was denied. And along with them being approved for Medicaid, if we don't do Medicaid with them, then we have to pay full price for a family individual plan instead of being able to get a subsidy or being able to get any kind of help. Like, you can either just, if you refuse Medicaid, then you have to pay full price. Otherwise, like, Medicaid is it. And I don't know anything about it. I'm not educated on it. I've never used it before. I don't know what the plans are. They don't have an easy website for you to go and look for the plans. So after we had the kids, like, all of a sudden, like, magically approved for Medicaid, Tim and I were talking about that, and we were like, that's really strange. Like, are we sure that they didn't make a mistake and we're going to be putting them on a plan that we actually shouldn't have put them on a plan, and they're going to get penalized for that, and there's going to be a bigger mess than we've already been in. So first thing in the morning, I call back Connect to try to find out, like, why in the world, how did this happen that the kids are all of a sudden approved for Medicaid? Like, what happened? Didn't really get an answer except for they're just approved, and that's it. So I call the Medicaid line to try to get the plans of whatever that they can be on, of what I can choose from and learn about Medicaid, and they tell me the kids were denied. And I was like, well, that's weird because I just got off the phone with Connect and they said that they are approved. And they're like, nope, they're denied. And I was like, well, what do I do from here? And they said, well, here's another Medicaid number, like the next line up, that you can call and talk to somebody there. So I call them and they say they're denied. I'm like,
okay, well, they're probably denied.
all right.
Good. At least we got that cleared away.
I'm like, but it's so stinking frustrating. And I'm just, I don't know.
Which is fine, because we probably didn't really want them on there anyway.
Right. But then I call Connect back, and I'm like, they're denied. Both places are saying they're denied. And they're like, well, they don't know. I'm like, really? Because if they're approved for Medicaid, I would think Medicaid would know. But Connect says, nope, they don't know. You choose a plan first, and then they know they're approved. It doesn't make sense. I don't know. Perhaps maybe it works that way. But because all of this has been so insane, we're just not doing it. We're not going to do any government help. Plus, I also even asked the guy from Connect, I was like, if we choose to put our kids on Medicaid, like, is it going to be this crazy to try to get through whenever we need help if there's some medical issue going on that we need to, like, figure out and have to talk to y'all about? And he said, well, the phone wait time is probably going to be about the same as what you've had. So 2-hour phone wait. That'll be probably normal to try to get through to somebody. But then, like, they would have their own number or whatever, so then we would be able to hopefully get answers.
Your own, like, account number.
Yeah. So I'm like,
well,
but answers haven't really worked anyways. After I wait for 2 hours on the phone, nobody really knows what's going on. Like, it just seems like one big, huge ball of mess. So we're just not going to do it. And
we're going to do something, but we haven't quite figured
we're not
it out.
We're not going to have any help from the government.
We might just have to pony up $1,000 some a month.
So I added up the total amount of time that I spent on the phone with all of these. Total with Anthem, which I love working with Anthem because they answer the phone. They know what they're talking about because they've done healthcare for, I don't know, since the beginning. And know what's going on, know how well. They don't know what ObamaCare is doing because that's just throwing everybody crazy, and ObamaCare doesn't even know what ObamaCare is doing. So I spent not even an hour with them, and most of that was probably my fault because I was probably ranting about what I was doing with Connect. Total, I spent 13 hours on the phone trying to get through. Over 12 of those hours was just on government phones, mostly being on hold. And that's just ridiculous. And I still, like, haven't gotten a clear answer.
Still don't even know. All we know now is we just don't want to mess with government stuff anymore.
Right. If it's this messed up, trying to even just get stuff set up, like, no thank you. I don't even want to, no, let's not sign up for that. So, but Tim thankfully called one of Dave Ramsey's ELPs and got some good information from him and an endorsed local provider.
We did get a couple other health plans from that guy to check out, and we are going to look into those. But either way, like, we're just going to have the fork out of pocket. Basically what happened is for the same price that we're paying now, our deductible is 3 times as high as it's ever been, like on any of other plans, for the same price. So if we want to keep our same deductible, we had to pay about $500 more a month just to get to that price. So it's just like that same deductible. So we are paying a lot more money every month for much less benefits, much fewer benefits, which I don't know how that's supposed to be caring for anybody, but thank you, I suppose. I told you it was not supposed to be political, but I guess it is.
I would actually like to know if any of this has, like, been helpful to anybody, like the Obamacare stuff. Like, I would love to hear, like, a positive story of that, like, that it is benefiting somebody, because for us, it has just created a nightmare. If you know yourself, especially, or somebody like that you know well that has actually benefited from this, like, that would be good to hear, because so far I haven't heard anything positive.
And we kind of feel like a little bit of a sense of urgency to kind of like get off of our old plan through COBRA from our former employer and onto a personal plan too, because like we actually wanted to start on January 1st on a new plan. And so on the old system, like Dana said earlier, we could have just called our insurance provider, they would have switched us over to new plan, would have been done. But apparently we didn't realize that at the time. And so when we went to switch in December, December. Here we are a couple weeks later, halfway through January, and now even if we got started like coverage now, like it's still the earliest it could start would be like March 1st. So we wanted it to start on January 1st, but in an old system that would have been fine. But now here we are, you know, we're like paying bills now that are just gonna be going towards a deductible that we're gonna reset in a couple months anyway, you know. So that's why we feel like a little bit stressed that we just wanted this done a long time ago, and here we are, it's still not done. So in case you care about all this health insurance stuff, that's what's been happening with us. We still haven't landed on what plan we're gonna do. I think we're gonna look into like MediShare or something it's called, and maybe a couple other alternatives. I'm not really sure. I don't know anything about those things. So if you guys know anything about any of that stuff, comment below and let us know what stories and experiences you guys have as we try to figure out what we're gonna do here going forward. So appreciate your guys' help and insights into that, and we'll look forward to seeing what you guys have to say.